Hi, I'm Dr. Patricia Krakos, a breast imaging radiologist on the medical staff of Baylor Scott & White Women's Imaging Center, Plano. I'm going to talk to you today about what to expect when you have a stereotactic biopsy performed on your breast. A stereotactic, or computer-guided breast biopsy, is a type of needle biopsy which samples a small amount of tissue from an abnormal area in your breast. The tissue is then sent to a pathology lab, which looks at it under the microscope to determine what caused the abnormality on your mammogram. This type of biopsy is usually recommended when the area is so small it cannot be felt and it is not visible when doing an ultrasound. Before you have the biopsy done, we usually recommend that you do not take any medications which increase bruising for 5 to 7 days before the biopsy procedure. This includes low-dose daily aspirin, blood thinners, any medications that can make you bruise easily. We also recommend that you bring a good type bra, such as a sports bra or an exercise bra, on the day the biopsy is performed, which will make you feel much more comfortable after the biopsy. And we want you to eat and drink normally before the biopsy procedure to make sure that you're well hydrated. The procedure is performed with you either lying on your stomach on a special table or sitting up in a special chair. The breast that is going to be biopsied is held in light compression similar to a mammogram, which helps hold it in place. 2 pictures of the breast are taken at different angles, which allows a computer to calculate the exact coordinates of where the abnormality is and exactly where the needle should be placed. A local anesthetic or numbing medicine is then used to completely numb up the area where the needle will be placed. After we're assured that the area is numb, the biopsy needle is placed into the area of abnormality. More pictures are then taken to confirm that the needle is in the appropriate place. Once the needle is confirmed to be in the area of biopsy, you may hear a buzzing or a snapping sound while we sample the tissue. You may feel slight pressure or nothing at all, but you should not feel any pain while the needle is in place. After the tissue is removed, a biopsy marker or miniature surgical clip is placed at the biopsy site to show where the biopsy was done. It is so tiny you cannot feel it and you will not know that it is in your breast. However, it is visible on a mammogram, so we can always know where the biopsy was performed. We perform a light mammogram to confirm that the appropriate area has been biopsied and that the biopsy marker is in the correct position. And we place a pressure bandage over the area. This can be an ACE bandage or the type bra that you brought, such as an exercise bra or a sports bra, which will make you feel more comfortable. We will give you written instructions on how to care for this area after the biopsy, including keeping the bandage on for 24 hours to keep the area clean and dry, and limiting any heavy activity using the arm on the side the biopsy was performed. So no working out or heavy activity for 24 hours, but normal activity is fine. And we will also give you a phone number to call if you have any questions or concerns after the biopsy is done. And the results are usually back in 2 to 5 days after the biopsy. The doctor who performed the biopsy will call you personally with these results and discuss any follow-up and answer any questions that you have. You should plan on spending about an hour in the center for the entire biopsy to be performed, and of course, we will make you as comfortable as we can.